I completed my general practice residency and started working in private practice, I started noticing all the different parts of interdisciplinary dentistry that I really wanted to know more about so I could better help my patients. That's where my journey in education started. And I started going all over the place, learning everything I could, anyone I could learn it from in different disciplines: restorative dentistry, occlusion, prosthodontics, aesthetics, orthodontics. A while later, there wasn't a whole lot of new things happening anymore. And so I started to look for a next level of education, something that was going to pull it all together in a different way, something that I was going to be able to be in the room learning from a lot of people that were smarter than me. And in that hunt is where I discovered Seattle Study Club. And it is this incredible network of educators and restorative dentists alike that are all coming together to learn about interdisciplinary care and to together in a collaborative way treat their patients better. You're starting to look for quality within your colleagues. You start looking for quality within your interdisciplinary communication. And Seattle Study Club really is just that. There is no better word than I can think of than quality. Quality of people, quality of education, and then at the end of the day, when you go home and you work in your practice, that's what you're delivering as quality of care. So that's how I was introduced to Seattle Study Club, because I was looking for more, and Seattle Study Club delivers more. I live in Toronto, and in the year 2020, Toronto was shut down, and we were shut down for 3 months, and our travel was limited for 19 months before I could get on a plane again. And I was used to traveling, learning, collaborating, being with colleagues. When everything shut down where I live, that's when I really started to see the weakness in the local community. And the weakness was there was not any local, in our backyard, high quality interdisciplinary learning. So what I did at that time was the opposite of what a lot of people did. I want to start a study club. I want to start a Seattle Study Club. And I want to start a Seattle Study Club so that locally, at home, we have the highest quality of interdisciplinary education. We don't necessarily have to travel everywhere for world-class speakers. We can bring them to us. Today, we have an incredible network of restorative dentists and specialists within this group. We have incredible partnerships with industry in the community. We have met so many incredible world-class clinicians and educators that have come here to teach us. And the conversations that are happening in our room and in our chat groups and personally between each other are different than they've ever been before. And the way that we help and support each other, I really can see it. It's made a difference to each person that's part of that group. And what I know about that is it means it's made a difference to their practice, a difference to their team, and a difference to their patients. I'm so happy to be here, and I'm so glad that I made that decision at that time. One question I often get is, as a restorative dentist, why would I start a study club? As a restorative dentist, why am I a club director? And the reason for that is that this quality of world-class education, this group of doctors that comes together to learn all together, it benefits our entire community. And as a restorative dentist, the reason I did it is because I love education. I get to organize the education. I love people. I get to help all these people. And I'm making a difference within my community. And it is kind of cool if you think about it, because as a restorative dentist, you're quarterbacking the interdisciplinary care. The patients are coming to you, doing your co-diagnosis, you're doing your comprehensive treatment plan, you're pulling in the specialists for the different consultations. So it kind of makes sense when you think about it in the study club that you are also coordinating in a way, organizing that education, getting those specialists together, and having those conversations from a slightly different perspective. So it's been a really cool journey, and I don't think that it should be exclusive to specialists or restorative dentists. I think it's a perfect journey for anybody who loves education, who loves collaboration, and who wants to grow.